Speaker, at around 10:30 p.m. last night, Scarborough Health Network had to make the heartbreaking decision to contact residents across Scarborough to cancel approximately 10,000 vaccine appointments between today and Monday due to vaccine shortages. Mr. Speaker, I would really like to get my question across because 10,000 people just found out they're not getting their vaccines, and I want the Minister of Education to listen, and I want all of the government members to listen. I'm outraged. It's outraging what you guys are doing. Mr. Speaker, I have stood in this House for months now, months and months, addressing the issue of vaccination for Scarborough. Like a broken record. I honestly feel like a broken record. And frankly, begging for an equitable distribution of vaccines, not just for Scarborough Southwest, but for all of Scarborough, only to get baseless, empty promises. The cumulative results of all the failures, the result is what we're seeing right now, with Scarborough Health Network having to close 2 of their biggest vaccine operations at Centenary Hospital and at Centennial College, because this government failed to provide our community with the minimum amount of vaccines necessary. Mr. Speaker, where are the 1.2 million unused vaccine dosages, and when will the government take our communities' pleas seriously? Thank you, Speaker.
I ask the members to please take their seats. And to respond, Minister of Health.
Thank you, Speaker. Well, I certainly have been listening to the requests that you have been providing, and I have continued to reassure you that the vaccine doses are allocated based on population and based on risk. Based on population, they've been developed equitably across the province. Based on risk, as the member will know, you have a number of hotspot neighbourhoods in Scarborough, and extra doses have been allocated. However, the issue here is of supply, and that is something that is beyond our control. That is in the control of the federal government. And while we know the federal government is making every effort that they can right now to get supplies to us, as the member will know, a number of those vaccine shipments have been either reduced significantly or missed in the last several months. While we now have an ample supply of Pfizer coming in, that wasn't the case during the middle of February. We also know that we received a shipment of Moderna the week of March 22nd. It was only 30% of what was originally expected, and we were told by the federal government that we would receive. The remaining 70% of our allocation, 225,600 doses, was further delayed and delivered to Ontario over the Easter weekend.
Thank you. Thank you. Thank you. The supplementary question.
Speaker, if the government was actually doing an equitable distribution, then why is it that, according to the ICUs data, which shows the province has vaccinated fewer people in hotspots than in non-hotspots? If you are receiving a small amount of doses, and I am not taking away blame from the federal government, I understand that both governments have responsibility. But if the federal government was giving a short amount, you should have prioritized hotspots like Scarborough. Why aren't you giving us more vaccines? Last week, government announced that the launch of mobile clinics without giving any notice to public health units, the community health clinics, health networks across Scarborough, across the province, or any information about rollouts, registration, or any details. Time and time again, this government expects local health networks to clean up their mess. Mr. Speaker, Scarborough has upwards of 24% positivity rates, and they're transferring patients to hospitals across the province, and our ICUs are full. This week, a couple in their 40s were transferred to another ICU while their 5-year-old, Mr. Speaker, child needed to be admitted because there was no one else to look after them.
Thank you.
Why is this government
Thank you.
continuing to be ignorant and neglecting
Thank you.